Welcome to Advocacy Politics Unplugged, the show that will dissect critical policy issues, explore the art of advocacy, and share insights on how to make your voice heard in today's ever-changing political landscape. I'm your host, John Ravitz, the Executive Vice President and Chief Operating Officer of the Business Council of Westchester. We're very thankful to our sponsors, Con Edison and Verizon. Con Edison customers, are you looking for an efficient way to heat and cool your home? Consider geothermal heat pumps. These innovative systems turn energy from the ground around your home into cooled or heated air for climate control, providing you significant energy savings and year-round comfort. Con Edison is dedicated to sustainability and helping customers save. That's why they offer incentives for installing geothermal heat pumps. Eligible homeowners could receive rebates that significantly lower their upfront cost. By choosing geothermal, homeowners won't just save money, they'll also reduce their carbon footprint and contribute to a cleaner environment. To learn more about geothermal heat pumps and available incentives, visit coned.com/geothermal. It's a smart choice for both homes and the planet. Don't just connect your business, make it even smarter. Partner with Verizon to gain the control, security, and speed to overcome challenges and adapt in real time. Verizon's cutting-edge networking technologies can help you build a strong, agile foundation for your organization. They help schools and small businesses access the essential technology they need to compete in today's digital world and are on a mission to help solve some of the biggest challenges the world faces today by leveraging their technology, innovation, and people. Verizon is working to open doors for many communities through digital skills training, grant opportunities, and more. To protect the planet for future generations, they're investing in renewable energy and improving the efficiency of their networks through the power of technology and shared knowledge. Verizon is helping people build the confidence to change lives for the better. Our guest today is Dr. Rajiv Ratan, the CEO of the Burke Neurological Institute. Dr. Ratan is currently the Winfred Masterson Burke Professor of Neurology and Neuroscience and Associate Dean at Weill Cornell Medicine. Additionally, since 2003, he has directed and built the Burke Neurological Institute, a leading organization whose mission is to cure neurological disability once patients have exhausted everything that the healthcare system has to offer. In this role, he has created and implemented a strategic plan to bring the very best in contemporary neuroscience to bear on repairing the brain and spinal cord. After receiving his bachelor's degree in neuroscience from Amherst College, he completed an MD and PhD at New York University and was inducted into the Alpha Omega Alpha. He trained in neurology and neurorehabilitation at Johns Hopkins from 1989 to 1994. He moved from Hopkins in 1996 to start the Neuroprotection Laboratory in the Department of Neurology at Harvard Medical School and the Beth Israel Medical Center. In 2003, he was selected to be the second director of the Burke Neurological Institute and was appointed the CEO in 2021. Raj, thank you very much. I am sorry if I butchered up some of your great accomplishments, but it is really impressive to see the work that you've done, and we're so glad that you could join us today.
Well, I think that, I just want to say at the outset that being part of BCW and interacting with you and Marcia and all your great team has just been another great reason why moving to Westchester was a good move for my family.
Well, and we're so honored to have you, but also thrilled to see the work that you and your team have done at the Burke Neurological Institute. But tell us, I gave our listeners a little bit about your bio, but tell us about your journey, the passion that you felt when you realized that this is what you wanted to study, and actually take what you've studied now into a role where you actually are seeing results.
Yeah, well, I think it goes back a fairly long ways, but I actually was very interested when I got into college in what is the physiologic basis of uniquely human aspects like love and sympathy and things like that. And so I became a neuroscience major in college, and it just, at a time when our understanding of the brain was even more embryonic than it is now, it just captured my imagination. And so I think the amazing thing is that I was fortunate to do an MD and PhD and realize that there are so many unanswered questions that doing a PhD would equip me with the ability to to use the frustration I felt in not being able to treat people better to actually go and try to solve problems. And I can't tell you that about how rewarding a career I've had. And I went to Harvard with the intention of really trying to make a dent on this problem, and it became clear to me that, in fact, the best rehab hospital for actually trying to convert, you know, uh, problems into solutions was the Burke Rehab Hospital. And it dovetailed with the fact. So, there were familial motivations to move uh, as we were both at Harvard Medical School, and at that time, my wife she wanted to teach and do really good clinical work. And so we decided it was time to move from Boston and considered a number of places. And the first time I walked on the Burke campus, there's an incredible spirit to the landscape, but the organization of the hospital was extremely unique among rehab hospitals in the United States. And fortuitously, Rini got a job at Columbia, which I think she's thrived in. So, and when I think I've told this story before, when I brought people from my lab down from the middle of Harvard Medical School, they never complained. They said, "This is a fantastic place to work and do science." And the Burke Foundation and the board was extremely supportive in my aspirations to, I think one thing that people don't realize is that, rehabilitation is really important. It focuses on disability. But let's take the example of somebody who has a stroke on the left side of their brain. They then can't move their arm and their leg. And if they can't move their arm and their leg, you can put them in a wheelchair and get them across the room. And if you work behind a desk like I do, then you can go back to work. But if you sell popcorn at Yankee Stadium, you're not going back to work. So the real goal of the Institute, as a totally complementary exercise to what goes on at the rehab hospital, is to get arms and legs moving again so people can actually have their disability cured. And that's the synergistic effort between the Burke Neurological Institute and the Burke Rehab Hospital. And I think it's what we are a leader in the movement to really figure out how do we cure disability. And I think what's been so amazing, which I think I've told you before, is when I moved from Harvard, my chair told me, "You'll never be able to recruit anybody to Burke." And exactly the opposite has been true, because it's there are so many things about the county: great schools, being able to live close to work, proximity to New York City. It's probably far easier to recruit people to Westchester County than actually even New York City. So I think we consider ourselves kind of a poster child for why great science can go on in our county. And obviously, Regeneron is even more amazing in their accomplishments. But I think it says a lot about why we came and why we've stayed.
Well, that's great. And you touched on the fact that your passion was the unanswered questions and
Right.
coming up with solutions to those. And that meant recruiting talent to help you find those solutions to those unanswered questions. What are some of the things you were looking for in terms of the people that you wanted to work at Burke Neurological Institute? And tell us a little bit about some of the important studies and trials that are going on right now.
Right. So I think that, with the idea of trying to repair the brain, I think there is a kind of notion that the brain is a blob, and if you have a disease like Parkinson's or spinal cord injury, that we can develop a drug that would treat all the problems that accrue from those diseases. And the reality is that the brain is actually it's like real estate. Geography matters, and there are different circuits that subserve different functions. So, for instance, motor dysfunction and paralysis is subserved by a circuit that is completely biologically different than what is responsible for vision or responsible for pain or responsible for cognitive dysfunction. And so I think the unique part of the organization of the Institute is that it doesn't pretend that one drug or one approach is going to be able to treat all the different problems of each disease. And so what we've gone out, and it turns out, so there's an area that, if you remember one thing called systems neuroscience, and the idea is that there are laboratories across the country that specialize in understanding these circuits and how they can be repaired. And as you and I both know, what patients care about is not, do I have a spinal cord injury? It's, I don't, I can't move. I don't have sexual function. I don't have bowel and bladder function. And so building a sort of medical construct where we're actually organizing the science around what patients really care about is it allows us to align what goes on in animals with what goes on in humans. And I think that the kinds of studies that we're doing are showing real promise. So for instance, we have a phase 2/3 pivotal trial of Alzheimer's disease, which we've talked about before, involving a nutraceutical called benfotiamine. Now, this trial is now 90% enrolled. It will read out in 2028. If it's successful, it could transform Alzheimer's treatment in the United States. And this has all been driven out of the Burke Neurological Institute because of the work of Gary Gibson. And what's really quite amazing is the current therapies that are approved all involve expensive infusions and toxicities. This drug would be non-toxic and would be cheap. So it could be deployed around the world. And so and it turns out that we are the only medical school or institution in New York that has a phase 2/3 pivotal clinical trial in Alzheimer's disease.
That's incredible. It really is. Our guest this afternoon is Dr. Raj Ratan, who's the CEO of the Burke Neurological Institute. Just hearing about that one trial and knowing the work that had to go into getting you to where you are right now, it's mind-boggling. But the reality is the ground has shifted for the life science community and the research that you do with the change in the administration in Washington over the last year.
Yes.
Talk to us a little bit about what you've seen and what concerns you with the changes of policy and the cuts in funding that have occurred.
Well, I think that, I think as you and I have discussed before, I think it's not, I think these are episodic shifts that are occurring on a landscape of real challenge. And that is that so despite the fact that the 99.4% of drugs are traced to an NIH grant, that life expectancy has been enormously improved. I think that over the past 20 years, since 2005, the NIH budget has not increased in real dollars. Medical inflation has been 66%, and the budget has gone up by 66%. And now the reason why that's such a challenge is because we've been continuing to produce PhDs who are trying to enter the system. And so the result of that is that, it becomes extremely hard to get a grant because you have all these people applying for a small amount of money. And the grant committees don't have the cognition to discern, the top 20%. It's sort of like getting into college these days, isn't that right? They can't discern the top 15 or 20% from the top 5%. So I think those are structural issues that have had a very negative impact on our ability to recruit the best and the brightest. Now, what has happened is over the past year, at a time where we're already strained, the shutdown of the government slowed review of grants. The Doge's reduction in the number of people who are actually employed at government agencies has slowed the review of grants. And then they've created a new system where instead of funding grants 1 year at a time, they're funding them for 5 years at one time. And so you can just do the math. And if you're funding 5 years, that means the number of grants you can fund is reduced by 80%. Isn't that right?
Mm.
So this has put enormous pressure, especially on young investigators. And these young investigators have they've done a PhD, which is 4 or 5 years. They've done a postdoc, which sometimes is 6 or 7 years. And then they start their faculty positions. So the amount of training that they've had is enormous. Their compensation is not great. And to face an environment where the possibility of actually getting a grant that would ultimately allow you to put food on the table, I think that's just it's going to chase a lot of people out of science. And I think that I don't know, I think there are many reasons why the NIH budget has not gone up. And part of that is that, I think American science and medicine is kind of always building expectations instead of providing certain realities about how science is done. So first of all, the NIH funds primarily innovation. They don't fund projects to see them through to the logical conclusion to patients. And unfortunately, amazingly, we haven't built an established model of how you go from a discovery to actually getting things to patients. And it's a topic of, but the other thing I think that is also important to note is that we don't socialize failure in science. So just imagine before we knew how to build houses, people would probably try to build a house, something would go wrong, they would deconstruct it, they would try again. Yeah, they would learn from their mistakes, they would try again. And ultimately, we got to a point where we really understood how to do it. And science is exactly the same way, except we don't know how to build the house.
Mm.
So instead of instead of being very honest about true failure, we're only rewarding positive results, whereas the blind alleys are very informative. So we should be rewarding both success and failure because it's a critical piece on the way to success.
Well, and your scientists, I mean, just using the building of the house, your scientists are the architects. And
Yes.
An architect has to draft a model, and then they tweak the model,
Yes.
and they redesign the model. And your folks are doing that on a daily basis. And I get what you say. There is a disconnect that we need to continue to really advocate for so that people and stakeholders and policymakers understand that. Go ahead.
No, I was just going to say there's another issue that I think is really instructive, and that is that there's a huge role for serendipity in science. And the example the somewhat intemperate example I always give is that when Viagra was first tested as an antihypertensive agent, and they gave it to all these men and women, and it didn't work, but the men wouldn't give the drug back. And so it forced them to figure out why, you know,
Mm.
and that's ultimately what led to its current use. But I think it highlights the fact that many things in science really depend on us really developing experiments that are, you know, are going to give us answers, but also being aware of unexpected observations. And that's why, you know, I always tell my faculty, you know, we really focus on process excellence because we can't control the results. And in many ways, it would be great if it would be fantastic if there were metrics for process excellence instead of results in a circumstance that's very risky.
This is Advocacy and Politics Unplugged, part of the BCW Podcast Network, sponsored by Con Edison and Verizon. And our guest today is Dr. Raj Ratan, the CEO of the Burke Neurological Institute. You know, Raj, and I shared this with you before we started taping the episode. One of the things you taught me over almost 2 years ago, and I don't even know if you remember saying this, but you said science makes a difference in solving critical public health issues. And the challenges now with the cuts in funding and the government shutdown that slowed things down, that's preventing science from doing what it's supposed to do.
Yeah. But you know, I think so. There are several comments. I would agree with you. I think, though, that any pressure on a system should result. I mean, theoretically, we are born creative problem solvers, and I think that maybe. I mean, I strongly believe that the social contract between academic institutions and the NIH has worked very well. But if we are in an environment, particularly where many people in our society don't really believe what I told you, they are not convinced that science is actually doing a good job of delivering outcomes that they care about. So I think there is, you know, an enormous opportunity for a creative rethink of how we organize biomedical research in order to be able to help people understand, uh, you know, what are the outcomes that determine success, and why they can trust us, because and a lot of this really, you know, this is why it's fantastic for somebody like me to be able to be on something like this. A lot of it is really just not helping the public to understand that, right? The complexity, the challenges, the opportunity, and that lack of engagement has translated into a lack of political, you know, energy to really go to politicians and say, you know, my mom died of Alzheimer's disease. It really bankrupted the family, not only in terms of our, you know, our emotional wherewithal, but because, you know, the costs of being in memory care or having other members of the family take care are just enormous. And so it it is in many ways a failure. It is also a failure of academic biomedicine to mobilize politically in a way that is most effective. And that's not, we have a lot of really wonderful people who are trying, but that's where we need help from people like you and others to sort of suggest, you know, strategies that are ultimately going to get people to really understand the stakes, and to understand that, you know, at a time when, you know, some people may feel it's appropriate to spend $85 million on ICE, we're spending $47 million on the $1 billion on the NIH.
Mm.
that disparity seems perplexing.
Well, we need to have leaders like you continue to raise the level of discussion on this. And I guess it's incredible that we're almost out of time. But the last question I'd like to ask you is, and if I could have the power, which I don't, but I'll always try, to be able to put in your boardroom federal and state elected officials who do have an influence on policy change, and you had the opportunity to speak right to them directly. You've touched on it, but what would be the one thing you would hope they would hear before they left that room?
I think I would hope they would hear is that, past is prologue, and the success of the NIH is ample example of what we've done, but that we have real significant problems ahead of us in aligning health span with lifespan. And I think, you hear Bhattacharya talk about how the NIH hasn't improved lifespan. We really need to work on health span. And the problems involved in making a better quality of life, those are problems that require deep understanding of, and I can speak for the brain, but it's true of other organs, deep understanding of how the brain works, how it goes awry in disease, and how we develop practical strategies to fix it. I think the other thing I would say is that, an ounce of prevention is worth a pound of cure. And we are learning that many neurological conditions start decades before they actually become clinically manifest. So we need to be putting as much effort into supporting public health efforts that are actually getting people to realize that it is in their power with relatively inexpensive approaches to live a longer and healthier life. And the consequences of not doing so are enormous personally, financially, and societally.
Well, look, we are so fortunate in Westchester County and in New York State to have the Burke Neurological Institute and the leadership of Dr. Raj Ratan, who is the CEO of the Burke Neurological Institute. Please know that the Business Council of Westchester is honored that you have chosen to be here in Westchester County, but more importantly, are excited about the talented you've brought to Westchester County, the work that those folks are doing on a daily basis to, again, make a difference in solving critical public health issues. And we will continue to advocate for you on all levels of government as you continue to do the work that is your passion. And that's something that, again, will save lives at the end of the day. So thank you very much for being with us this afternoon.
Well, it takes a village, and we appreciate being part of your village.
Well, we do too. This is Advocacy and Politics Unplugged, part of the BCW Podcast Network, and we are again thankful to our sponsors, Con Edison and Verizon.
Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, What's Trending, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more about the Business Council of Westchester, please go to thebcw.org.